Hi, I'm Jack West, medical oncologist at Swedish Cancer Institute in Seattle, Washington. And I wanted to talk about why chemotherapy is so often integrated in the treatment plan, not only for the people with advanced lung cancer, but also for many of the patients with earlier stage disease. Now, it makes intuitive sense why we would recommend a systemic whole-body therapy like chemo for patients who have advanced metastatic cancer. Their cancer is spread throughout the body, and we want a treatment that will also travel throughout the body to treat disease everywhere. But why do we recommend it for patients who have earlier stage disease as well? The answer is that for all but those with a smaller lymph node negative cancer, typically stage 1, and really here I'm focusing on the patients with non-small cell lung cancer, the most common subtype, those patients who have anything other than a smaller node negative cancer have a high risk of recurrence, a little too high to just rely on local therapy like surgery or radiation alone. And chemotherapy ideally is going to help mop up any stray cancer cells that are able to travel throughout the bloodstream, that are invisible at the time of surgery, that can't be seen on any scans, but that we know have a risk of recurrence. And so chemotherapy is typically added. It's given post-operatively in many cases, sometimes pre-operatively, for patients with locally advanced disease, which is stage 3. We will typically give chemotherapy in combination with radiation, sometimes also with surgery. And the idea is to combine a treatment that is really local, treating the disease we can see in the chest, with a systemic therapy, so treating on a global front as well. And so, because lung cancer so frequently becomes a systemic disease, even when all we can see is localized in the chest, we very often want to give a systemic therapy, so typically chemotherapy, to reduce the risk of distant recurrence. I hope that's helpful. Good luck.